Yeah, as I think about this question, one patient really comes to mind. It was a patient that flew from Hawaii to see me. She had a devastating injury to her lower abdominal wall, young female, and then after her C-section, had an infection of her lower abdominal muscles. The trauma surgeons there had to remove almost her entire lower abdominal wall, and she was left with a massive hernia. At that point, I knew there would be very limited soft tissue reconstructive options, so the mesh was going to have to suit this 24-year-old woman by holding for the rest of her life. And I also knew that, several years ago, we started talking about central mesh failure and meshes that if you bridged a defect, they might break in the middle. And so I knew the material was going to be critically important in this patient, and that I couldn't have it break long term. And so kind of concomitantly with that, I had built an experience with SYNECOR mesh, and I knew the durability profile of that material would really be a perfect match for this patient that I was going to have to bridge. And so I put the mesh in for her. I put bone anchors in her pubic bones and her ASIS and really built her a new abdominal wall with SYNECOR. And she did great. And she's now, I think, 4.5 years out. We got a CT scan for surveillance, and it was read as normal abdominal CT. And so I always remember her because she had a massive hernia, a lack of abdominal wall. We reconstructed with this piece of mesh, and she's now, almost 4 or 5 years out, and she's doing phenomenally well. So I always think of her when I think about materials mattering.